A hearty welcome to my channel Kunjapan Sebastian. Our topic for today is depression. All of us undergo mood fluctuations in our daily life, but these mood fluctuations are transient. It is normal and natural for people to feel sad about or grieve over bumps in their lives. But depression is different in that it persists practically every day for a period of at least 2 weeks and involves other symptoms than sadness alone. Depression is a mental disorder that causes persistent feelings of sadness, emptiness, and loss of interest or pleasure or joy in most of all normal activities such as hobbies, sex, or sports. Before going further, may I request my viewers to kindly like, share, and subscribe to my channel, and it shall be highly appreciated. The other symptoms of depression are tearfulness, hopelessness about future, worthless, overly worried, angry outbursts, irritability, frustration over small matters, sleeping disturbances like insomnia or sleeping too much, tiredness and loss of energy, so even small tasks need extra effort, reduced appetite and weight loss of increased cravings for food resulting in weight gain, anxiety, agitation, restlessness, slow thinking, loss of decision making, ability, forget, forgetfulness, frequent thoughts of self-harm, death, suicide, attempts to commit suicide, backache, headache, stomachache, sexual dysfunction, poor concentration, feeling of excessive guilt, loss of self-esteem, increase in purposeless physical activities like pacing up and down and hand wriggling. Depression, if not diagnosed early and treated, it may aggravate and last longer. In severe cases, depression may lead to self-harm and death by suicide. Fortunately, depression can be treated effectively irrespective of whether it is mild, moderate, or severe. Depression can affect anyone, even including children. It is reported that more than 16% of adults and 4% of children have depression. Depression affects more women than men. There are different types of depression. The most common and severe type of depression is called clinical depression. Children around 10 years of age get depression, the major symptoms being extreme irritability and frequent angry outbursts. Women may get depression before the starting of periods and is known as premenstrual syndrome. They may get depressed during pregnancy, known as prenatal depression, and for a period of about 4 months after delivery, known as postpartum depression. Women may get depression after menopause. Some people are sensitive and get depressed during the months of fall and winter when there is less daylight, known as seasonal depression, and feel alright during spring and summer. Researchers do not fully know the exact cause of depression. According to them, several factors like genetic, biological, environmental, and physiological contribute to the development of depression. An imbalance of neurotransmitters in brain, including serotonin, dopamine, and norepinephrine, may be one of the main causes of depression. For a person having a family history of depression is likely to get the disease. Certain diseases like stroke, hypothyroidism, heart disease, Parkinson's disease, Alzheimer's disease, seizures, cancers, and chronic pain may cause depression. Stressful bumps in life like death of a loved one, traumatic events, long-term unemployment, living in an abusive and uncaring relationship, job loss, divorce, long-term isolation and loneliness, lack of support, prolonged job-related stress, relationship changes, financial problems, incurable diseases, and head injuries may trigger depression. Some medications may cause depression as a side effect. Abuse of substances like alcohol, tobacco, ecstasy may cause or aggravate depression. In case you are in doubt that you are having depression, several confidential online tests are available to find out whether you are depressed. And if found positive, the degree of depression and mental health. Alternatively, you may consult a mental health professional for diagnosis. Depression is diagnosed based on your symptoms and the mental health. Mental health professional may ask you several questions to arrive at your present mental health and level of depression. Also, he may evaluate your medical and mental health histories and treatments undertaken, if any. A complete blood test is also done to assess whether any underlying factor is causing depression. Coming to the treatment, depression is successfully treated by employing psychotherapy or talk therapy. Here, the mental health professional will converse with the patient to bring to surface the thoughts, emotions, patterns of behavior, and advise him the ways and means to change the unhealthy traits. Also, antidepressant medications may be prescribed if needed. When undiagnosed and untreated, depression may become severe and cause noticeable problems in day-to-day activities at home, school, or workplace. When the patient is not responding to treatments, electroconvulsive therapy (ECT) is found to be effective. It is a safe and controlled procedure in which, under general anesthesia, a small amount of electric current is passed through the brain to cause a brief seizure. Hope you find this presentation useful. Kindly like, share, and subscribe to my channel, and it shall be highly appreciated. Thanks for watching. Bye till we meet again with yet another episode.